over to Dr. Vivek Padigal, who is a Senior Consultant Director of Pulmonary Services at the Fortis Hospital, Bannerghatta Road. Welcome, Dr. Vivek.
Thank you. You have viral symptoms, you isolate for a week. Please do get tested. A lot of people are not getting tested even though they're having symptoms. Getting tested is a very important thing. Number one is you know what you have. Number two is if you have somebody at home who's tested positive, even if you're asymptomatic, please get tested. It's very important to know where you are, because if you're asymptomatic today, 5 days later, you may not be asymptomatic. And the other thing is just because you're asymptomatic doesn't mean you're going to not spread it to others. So there's a lot of confusion about these things. Asymptomatic patients are the biggest spreaders of COVID. So if you're not having symptoms and you've been exposed, please get tested. That's very important. And the press has really been reporting this wrong, saying we are only testing symptomatic patients. The headline should have been symptomatic patients and close contacts at one point. So a lot of people and doctors told me, you're not having symptoms, why do I need to get tested? So you need to get tested. Okay. That was just to complete the circle on that. I have been through 3 pandemics: the HIV pandemic, H1N1 pandemic, and the corona pandemic. And not surprisingly, I have never ever seen anything like this. The H1N1 pandemic at its height, I was actually in the US then, was pretty scary. We lost a lot of patients, but it pales in comparison to this pandemic. So the perfect virus almost. So this has been a very, very eventful, tumultuous year for me, and a lot of lessons. And having to take care of patients over this last 1 year, learning on the fly, so to speak, because we really didn't know what to do, especially last year. And luckily in Bangalore, at least, we got it at the tail end in India. So there were lessons learned in other places that we were able to apply. So we did pretty okay in Bangalore last year. But this second wave hit us, and it hit us hard. I don't think anybody anticipated how ferocious it was going to be. We had a virus which was extremely, extremely contagious. And because of the sheer number of people who got infected, we had our ICUs, hospitals, all full. And simultaneously, because of the large numbers, we ran out of medicines, oxygen in some places, nursing staff, doctors. It was incredibly tight for about 6 weeks. We ran out of equipment, didn't have places, had to tell your own family and friends that you couldn't help them. So that was very, very difficult time.